Doctor, as a leading gynecologist and one of the unique sexologists in the country, I'm pretty sure you have handled a lot of cases with vaginismus. How
Let
do
me
you
thank you first for that.
how do you typically approach these kind of cases? I mean, how do you diagnose where the issue is, and what are the kind of solutions that you have, both in terms of procedures as well as counseling?
Okay, yeah, that's a very good question because, like, they would feel pain, but they don't know the reason. Okay, so sometimes they have online consultation, which is very hard to actually diagnose if there's a physical problem. So I would advise them to come directly for a physical examination, which is very gentle, not painful, just to know whether they have a thick hymen and if they have the muscle going into spasm. So we would do a gentle examination. And in my career, what I felt that like most of the patients, around 90% would require a procedure which we call as Fenton's procedure or hymenectomy, because what we do is that if they have a thick hymenal ring, it's a physical problem. So when the male is trying to penetrate the female, if the ring is very thick, they will have pain, which will cause the woman to actually go into spasm. So the vagina has a circular canal, like, cylindrical structure. The circular muscle going into spasm means it's going to go tight.
Contract.
So already the hole is kind of smallish, small, whatever. And if it goes tight, it becomes smaller and it becomes more painful. So unless in the psyche or the brain of the women, they should recover the feel that it is not painful. So it's not just psychological. It's in most of the cases we find that a very thick hymen is there. In a very, very small percentage, it is just psychological. And in those cases, counseling alone might work. And again, when it comes to surgery, I said like Fenton's and hymenectomy, but if the muscles are also tight inside, we'll have to inject Botox. The same thing you apply for the film stars or
Facial
guys
muscles.
to remove the wrinkles. So the same Botox, which is very safe, if we inject into the vaginal walls at a particular place into the muscles, it becomes loose and it will stay loose only for maybe 4 to 5 months. By the time we actually treat these ladies with dilatation procedures, and then we ask them to undergo a lot of counseling. So there will be counseling maybe for anxiety, childhood problems, relationship problems, and most importantly, sexual counseling, sexual education, and sex therapy.